At Politecnico di Milano, we work on particle therapy of tumors that move with respiration, like abdominal or thoracic tumors.
To fully exploit particle therapy, respiratory motion should be addressed precisely during both treatment planning and also delivery. The current standards in the clinic nowadays do not give a very precise description of this motion, so our efforts rely on the MRI to demonstrate its potential to describe precisely respiratory motion and its induced uncertainties.
Standard for treatment planning and motion management is a 4D computed tomography, or 4D CT. Due to intrinsic limitations, however, a 4D CT cannot provide precise respiratory motion information. It gives us only an average description of motion, which is not always representative of the actual motion between or in fractions. At the same time, it is also very prone to artifacts. Regarding treatment delivery, the current standard is a motion mitigation technique called gating. Gating uses compression masks, which are applied on the patient's abdomen to mitigate respiratory motion. The tumor is then irradiated within a gating window, usually the end exhale respiratory phase, while the beam on time is signaled by external respiratory surrogates. However, this technique is very time-consuming, and ideally we would like to irradiate the tumor under free breathing conditions with full motion compensation during the irradiation session. So what would be an improvement to the previous limitations? For planning, our efforts rely on MRI for motion management. MRI, in contrast with CT, is a radiation-free modality with high soft tissue contrast. It provides lower acquisition times in dynamic modality, and it consists of two modalities, the time-resolved MRI or SINE MRI and the respiratorily correlated 4D MRI. It provides advanced imaging for motion management, and indeed it gives us an improved description of the respiratory motion. It is not present in particle therapy, but many studies claim that it would be the future. However, the only drawback of MRI is the lack of density formation, which is needed for those calculations. In this regard, my work involves the generation of pseudo-CTs from MRI data suitable for those calculations, using either mathematical methods or artificial intelligence-based solutions. Regarding treatment delivery, my work involves estimating the internal tumor position during irradiation by relying on the motion of external markers placed on the patient's skin, monitored by infrared cameras. A patient-specific correlation model would correlate the marker's motion to the tumor motion, thus giving us the tumor's position during irradiation. This correlation model would be augmented with MRI information presenting precise motion information to make the delivery more robust against motion.